want to talk about a couple important things for cardiomyopathy. And we'll focus on dilated and hypertrophic. So with dilated cardiomyopathy, as just a reminder, you have dilation of the ventricle and the atrium. So you can see here these areas are dilated. And so you now have a very inefficient heart. And typically this happens slowly over time, and eventually you're going to see patients having signs and symptoms of heart failure. With hypertrophic cardiomyopathy, you can see that the ventricle here has hypertrophied. It is very thick, and because of that, it has really diminished the size of the ventricle there. So whether you have dilated or hypertrophic, you have a problem here with being able to move blood forward from the ventricles. So this patient, again, too, may be symptomatic, but eventually will develop signs and symptoms similar to heart failure. So you're going to have exertional dyspnea, fatigue, angina, syncope, and dysrhythmias. So for both patients, your focus is going to be very, very similar to your heart failure patient. So all of that heart failure teaching that you learned before, you want to make sure you're bringing that back to this patient as well. They're going to need medication teaching. They're going to need to know what kind of meds they're on. Diet will be important. Low fat, low cholesterol, low sodium diet. They may or may not be on a fluid restriction. So this is going to be something that would need to be clarified with their provider. If they're on a fluid restriction, then we would teach them whatever that fluid restriction is. But if not, we're going to encourage them to drink 6 to 8 glasses of water a day. We want them to be hydrated. We don't want them to become dehydrated, because then that increases the workload of the heart, which could then put them into a heart failure exacerbation. So we have to find a fine balance there. Maintaining a reasonable weight, trying not to overeat. When you overeat, it becomes difficult to breathe. You feel fatigued. We're going to avoid things that increase our heart rate, such as alcohol, caffeine, some over-the-counter medications. And we're really going to have to, again, balance our rest with activity. So this, again, might not be a patient who can run on a treadmill. You might be doing some chair exercises or walking, things like that. Try to reduce stress. Knowing all those signs and symptoms of heart failure exacerbation will be extremely important. If the patient is near end of life, we may need to also be talking to them about knowing CPR, their caregiver knowing CPR, because of their risk for sudden cardiac death. And at some point, you may be focusing more on end of life or palliative care, and so that will be something you may have to explore with the patient and their family. One thing that's very specific for patients with hypertrophic cardiomyopathy that we want to remember that is really different from all of our other cardiac patients is that if they have hypertrophic cardiomyopathy, we want to avoid any strenuous activity. We have to remember that any activity can increase the systemic vascular resistance. It can be very dangerous for this patient. So you have to remember, when you look back at that picture of their ventricle, of the left ventricle, remember how hypertrophied it is and what a small amount of blood can fill into that ventricle. And so any increase in activity, increase in heart rate, it could really cause a decrease in amount of blood flow that is actually being ejected from the ventricle, because it's moving much faster now, and remember, it's unable to dilate and fill. So it can be very dangerous for them for perfusion, which could then again result in that sudden cardiac death. It's important for them to rest frequently, and when they do rest, elevating their legs, improving the blood flow back to the heart, which again decreases the workload of the heart, making it easier. They also want to avoid medications such as nitroglycerin. This can actually increase their chest pain. And so if they have chest pain, it is contraindicated for them to have vasodilators.